the technique in histopathology, the Q initiative. So what we have already the introduction on what is all about for the today's session. So then probably what is the Q initiative? Maybe I think Prof. Nahayati also have already give a clue for what we will talk about this session today. So the technique in histopathology, because I'm sure we have many MPath students, we have many young pathologists here that are here together with us today. Then I think this topic is still relevant to all of you, because because I was the examiner for the conjoined board for the conjoined NPath program, and I can see this is the lacking area for almost all the candidates during the exam, and the quality management system in histopathology laboratory. Almost all of them, when we ask about this quality management system, or even in any quality questions, probably sometimes they like no idea, or maybe they just ignore during the training, or they don't care about this. Maybe they thought this is not their job yet, but like it or not, when you are a pathologist, you have to know and you have to like it. So this quality management system in histopathology laboratory, for the introduction, before we go further detail on the technical module. Yeah. So what is the quality management system? So the quality management system is the coordinated activities that can control, that can direct an organization with regards to quality. Anything that regards with quality, that include all aspects of the laboratory operation, your organizational structures, your operations, your processes, your procedures, everything that related to the quality, that include under quality management system. And those labs who has a good quality management system will be able to reduce or eliminate the laboratory errors. Okay, we can meet the customer expectation. Okay, we can have a more efficient operation, and we also can have the greater potential for successful accreditation assessments. And in addition to the quality management system, we also have the quality control, which play a very major role or critical role to check the programs, to check whether it works properly, the functioning well, consistent, precise, and accurate laboratory results. So this is very important. Okay, so the quality control is part of the quality management system. And we also have another terminology, that is QA, quality assurance. What is the difference between QC and QA? So when we talk about the quality control, it refers to the measures that must be included in each of the steps in your test in the laboratory, so that you must make sure that the test is working properly. So when this quality control works effectively, we can troubleshoot early, we can correct all the flaws in the analytical processes, and we can prevent, okay, the potential incorrect patient results release. Yeah, so this is very important. But the QA, or quality assurance, is the program that ensure the final results reported by the laboratory is correct and accurate as possible. So in other words, the QA, or quality assurance, aiming at ensuring quality test results. So then what is QC in histopathology? Our QC in histopathology is slightly different. Unlike in chemical pathology, we have the equipment, we have the machine that they produce the numbers, they produce the data. We can see the outlier if you from the analysis. Okay, but in histopathology, it is slightly different, because we don't have that data, we don't have that numerical data, but we have the descriptive reports, very subjective, and And most of the time, it is more on individual judgment, and the reporting patterns also different with different pathologies. Yeah, so that is make an assessment and implementation of the quality control. I won't say it is difficult, but I would say it is unique as compared to other laboratory disciplines. So, but it does not mean that this cannot be done or cannot be achieved in histopathology. So whatever it is, in other disciplines in laboratory medicine, we still apply these three concepts of the quality control, which is the pre-analytical, analytical, and post-analytical activities. So what is the pre-analytical QC or process in histopathology? When you receive the sample at the counter, then you process, then you section, you stain, you mount, and you make sure the slide is ready for the pathologist viewing. That is the pre-analytical process. The analytical process is the one that interpretation of the slide and making an accurate diagnosis by the pathologist. And the post-analytical process is the transmission of the report, yeah, the storage, the disposal, the retrieval of the test results, and so on. So I think everyone is agreed that a good quality histological section is the key point of an accurate histopathological report. We don't want to have this kind of section that have the artifact, so it will jeopardize the diagnosis later. So that's why in ISO 14189, there is a special focus on the external quality assessment, which is under class 5.6, the interlaboratory comparison, which is very important. So like Prof. Nahayati already mentioned, of course, we have this interlaboratory comparison before we enroll to RCPA, that we have already the modules, including the technical modules. But I am also personally agreed with Prof. Nahayati that we lacking at the national level, but I think that we need to have our own assessment that we also can be at their par. The assessment by the internal and external quality control and assessment scheme that we produce, then I think it can also be precise and as accurate as they are. So the diagnostic module that we have, yeah, the IAP products. So this is what we call the IAP initiative, the initiative that we have to a better quality of the histopathology, which is the EQA. Okay, as Professor Nahayati already mentioned, we already have the diagnostic module run twice per month, twice per year since 2015. Okay, and the matopathology module, which recently, okay, introduced last year, and it was run once per year. So these two diagnostic module and the matopath module assessing this analytical process, but we still don't have the technical module, which focus more on the pre-analytical process. And of course, when we have this efficient and this one is good, of course, we could produce a very good analytical process, which can produce a good or accurate interpretation later. So this is the new products that IAP will introduce, inshallah, by next year for the better quality. This is the Q initiative that I've mentioned. Okay, the initiative for a better quality in histopathology, which is IAP MD technical module, which will consist of the H&E and special stain. We have two in one. And our objective is to provide the external proficiency testing of laboratory methods for H&E and also the special stains or histochemical stains. And of course, we know that in order to have a very good quality histological section, which need for the accurate histopathological report, we need to have a very good H&E section for the morphology, because this is the core job in pathology. We need to have a very good H&E section. So it is not only play a critical role in the diagnosis, in the prognosis, but also like in our institution, we also is also important in the research and also for the teaching. And the special stain, as we all know, that the special stain can help us to see the details of the tissue sample that cannot be seen by H&E, and it is widely used in the special case like renal biopsy, liver biopsy, or in identification of the microorganisms. I always wonder when we have audited by the when we were audited, and when we put the renal biopsy, one of the scope for the accreditation, so they always ask us about the interlaboratory comparison for the renal biopsy, which we don't have. But actually we can have this because we can assess the special stains that is widely used in this renal biopsy by doing this interlab comparison by the special stain that we participate in this exercise. So this is part of the interlab comparison that probably could give a value to that special case or special biopsy like renal biopsy or liver biopsy as well. So of course, it will provide the proficiency testing or external quality assurance that directly associated with the analytical outcome of the staining results, in that we can detect the variation in the staining quality, because when we are assessing our lab, we thought our lab is the best. We thought there is nothing wrong with our lab. But when someone else look at our lab, then we know there are something not, probably that this certain area are lacking and whatnot. And if we have this interlab comparison, then we know where is our standard and where is our lab in comparison with other laboratory in Malaysia. Yeah? And of course, we can detect the variation, and this we can correlate with the procedure parameters, with your stainer platforms, and so on, and in order to determine which factors that can contribute to adequate or inadequate staining results. In that, we can offer, or it can be offered, the advice can be offered on how to attain the highest staining standards possible. So we by emphasize the troubleshooting, the technical tips that are all essential component in the competency evaluations. And this module will cover the assessment that is based on the circulation of the serial sections of standard process tissue, okay, that to be stained by in a large number of laboratories in Malaysia, and will be evaluated by the panel of experienced, which will be from the experienced pathologists and the technical staff. Yeah, the technical staff like the senior MLT or the scientific officer, who will be appointed by the IAP MD. And before I go further for the general instruction, okay, so we have agreed that this cycle or this technical module will be will run once per year. Okay, we run once per year. It means that one cycle per year. Of course, there was a suggestion to make it twice per year, but I think for the beginning, for the start, we probably start with the one cycle per year, which consists of 2 in 1. We have H&E and we also have special stain in one cycle. And every cycle will consist of different type of tissue and different type of special stain. And we propose the date February each year. Yeah, we propose the date February each year because we already have the MatoPES module, and we also have the general module. So this is the general instruction that is will be instructed to the participant. But number one, to prevent or to avoid the conflict of interest or to avoid the bias during the assessment process, the unique QAP registration number to all participated labs will be given. So we don't know the hospital USM is or hospital Kuala Lumpur or HRPZ. We don't know because we just received the slides with the unique number. And all the participated lab, this is a slightly different from the one that we did in the technical module from the RCPA, because in RCPA technical module, they give us the unstained slide. Okay, but this one, we don't give you unstained slide, but we would like you to prepare the tissue. Okay, for example, for next exercise, we decide to have tonsil. So every lab that is participate will send us a tonsil tissue with the measurement between 10 times 10 to the maximum diameter of 15 mm in dimension. So we have standardized certain factors to make it easier for the assessment. So the tissue size will be standardized and the tissue type also will be standardized. So each of the cycle will only assess for one type of tissue. So if tonsil, everyone will send us tonsil. If skin, everyone will send us skin. Okay, and the type of special stain, these are the type of special stains for assessment that we have listed. And for example, if the next cycle we have decided to have pus, so all labs will send us the colon tissue or the liver tissue with pus stain. So that's how the technical module from IAP MD will run. And we also have the case note, like in our technical RCPA, we also have case note that has been emailed to the participant. So this case note will be emailed to all the participants together with the questionnaire. So this questionnaire will be in the form of the Google form and will be emailed to all participants. So why we need this questionnaire? The questionnaire is actually try to assess all the technical parts. For example, whether you have, where did you store the reagents, whether you store the reagents correctly, whether you follow the protocol exactly, whether you take a particular care in each steps or certain steps like washing steps, whether you document any changes from the method that you are using, and whether you are you have a very consistency and a quality of slides. So this will be assessed by the questionnaire in which will be converted into the Google form and will be emailed to the participant. And the stain slide, as for example, we have a tonsil tissue with that stated measurement 10 times 10 to 10 times 15 mm diameter, for example, and you have stain for H&E, and also you have colon, for example, and you stain for pus. Okay, so you will stain these slides and you send to the provider using the slide mailers, and you have to answer all the questionnaires. Yeah, and this if we start on the 1st February next year, so probably expected to, at the end of the February, within 1 month after the email notification, we have already received all the slides from the participant. And the online, and then after that, it follows by the online assessment session using the score sheet by the assessors. Yeah, so this probably will be done after 1 month after the slides received, expected in March. So these are the assessment criteria that we propose, which is actually adopt from the RCPA technical module RCPA as well. Basically, we actually assessing the same thing. Okay, we are assessing the processing and sectioning by looking at the slides, whether the slide thickness or the artifacts that's present, whether we have the excess bubble and so on. So that will be assessed. That will be under category processing and sectioning, and the staining quality, whether we have a very good contrast and so on. So these are the list of the assessment criteria that we have listed here for the H&E and for the special stains. And these are the score. Yeah? These are the score from 0 to 5. 0, no staining or no submission. 1, undiagnosable. 2, unsatisfactory staining, which all the criteria has not been met. The 3, the criteria at least met the basic level. 4, above average, and 5 is perfect. So when you have not submitted the material, or the material submitted late, or insufficient, or maybe there is a technical problem that preventing assessment by the assessor, this will be categorized as unable to assess, or maybe zero, yeah, zero. So there will be an independent assessors. You don't have to worry about the bias on the assessors, because the assessors will be from the different institutions in Malaysia, and they are experienced pathologists and also experienced technical staff, yeah, in Malaysia. So don't worry about that. They are all the experienced assessors. Okay. And after that, we have done that, so we will do the survey reports, which we will assess the score analysis, the one that we have listed, the assessment criteria. So we have, if the satisfactory 3 and above, borderline 2.5 to less than 3, and if unsatisfactory less than 2.5. And we also analyze the questionnaire so that we can produce the individual lab and overall lab performance, and we'll also will capture the image for, at least for your reference, what are the unsatisfactory, what are the borderline, and what are the satisfactory cases for your reference. And lastly, the QC check before we produce the report to the participants, so that the report is for your lab, not for other lab. Okay. So these are the things that we will do. And these are the sample of reports that we will provide. Okay, so we'll capture the image so that you can see what are 5/5. This is the reticulin stain. Okay, what are 5/5? What are the unsatisfactory? Yeah? What are 0? And what is the 5/5 for the HNE? Okay, so it's something like this. It is unsatisfactory. Yeah. Poorly fixed tissue, non-nuclear detail is seen, so this is unsatisfactory. So and then this is a quietly looks like good contrast staining, but you have a very bad artifact here, so this is also unsatisfactory. So this is 2.8/5, but it is not as good as the contrast is not so good. We cannot see the hematoxylin clearly, only eosin is prominent, then probably is still not doesn't meet the basic criteria. So at least 3, then it become at least meet the basic criteria, and it will be the satisfactory report. This is the report from your questionnaire. Okay, so for example, this is the reticulin stain. Okay, so there will be a number, the unit number for that particular lab, and the participant score for the exercise that we score the image just now. And after that, we will put the results, whether the result is satisfactory or borderline or unsatisfactory, and the comment from the assessors, and also these are the comments that you can relate with your process at your laboratory level. And this is the overall lab performance that you can see where are you as in comparison with the other participants. Yeah, whether you are at the top, whether you are at the average, or you are lacking in whatnot. So you can see, and we can improve from that. Yeah? Of course, we encourage all the labs to have a regular technical meeting so that we can discuss and we can improve from time to time. So this is very important especially for the not only for the well-established laboratory, but it's also very important for the newly starting laboratory, or maybe you have a new lab to be set up. So this is very important. Okay, so after we have done that, okay, we will return the slides to participant, because the slides are from all of you. You give us your stain slides from your lab, so we will return the slides to the participants. Okay, and we also email the survey report to the participant, and the generic reports will be uploaded in the IAP website. So this expected to be done 2 months after the slide received. Expected by end of April, this will be completed. So I think that's all from me. So anyone interested for joining the technical module, Dr. Natasha, you have the Google form for the feedback. I think you can put it in the chat later. Maybe because we have the feedback form in the Google feedback Google form to see how many of you are interested to join, so that from there we can give you an invitation for the trial. We plan to have the trial run for this technical module, so that from the trial run we can pick up all the probably the weaknesses within this technical module. Is slightly different from the diagnostic module, because diagnostic module we can give you the slides or images, then you can see and then you try to make a diagnosis. But this is the technical. Technical means there are many analyses that can had to be done. So we plan to have a trial run before the actual exercise from the IAP-MD. So this trial run is very important for the provider, and also probably from all of you who would like to participate, so that I hope everyone here can participate, so that we can know and you can assess us as well, and you can suggest for the improvement. Yeah, so I think that's all from me. Thank you.